of the less well-off, PM Lee 2 weeks ago unveiled benefits for Singapore's pioneer generation, which will cover about 450,000 people. That's close to 500,000. Among these are greater support for MediShield, life premiums and more subsidies for outpatient treatment and annual MediSave top-ups. Now, those details will be spelled out this Friday during the budget announcement. But for now, let's discuss the healthcare concerns that the elderly may face. I have with me Associate Professor Phua Kai Hong, a health analyst from the Lee Kuan Yew School of Public Policy. So, Professor, it's a pleasure having you here today. So, rising cost of healthcare is a major concern for everyone, not just seniors, but for them in particular. About 500,000 are going to benefit from this new package. Who in particular among that group do you see benefiting the most?
I think this will be the pioneer generation that was born before 1950, and also those who took up citizenship before 1987. So I think this group that did not have enough savings, whose wages were very low when they were working, and therefore would not have built up enough MediSave. So our system now increasingly is going to be built upon the 3M, MediSave, MediShield and MediFund. So I think we will have to top up the MediSave savings to pay for this increasing cost of healthcare.
So among that group also a rising number of elderly women who are widowed or single as well.
Yes, especially I think it should include that generation of a large group of women, in the old days who did not work or did not have enough opportunities to work and were not as educated. I think women also live longer than men, so the increasing life expectancy of women, there will be a significant group who would not have enough savings if we are going to rely on the 3M system.
Okay, Professor, seniors, of course, going to get help with healthcare costs, outpatient bills, subsidies at polyclinics. But it's not possible to cover every single area. But do you see this as a good start?
I think it's a good start because we are aiming towards universal health coverage, but we are not veering towards overly generous welfare state. So we have to balance the need to be sustainable as well as what is affordable. I think this is the generation that have built up enough for our generation, and I think they should be supported. So I think we will start off by taking care of the low-lying fruits, the big ticket items, which is your big medical bills, and that has to come from MediShield Life.
Okay, let's talk about affordability in a moment. For now, let's talk about how crucial it is to get the basics right from the start.
Well, I think we do the big things first, but I think overall you have to tackle the whole system comprehensively. So if we start off by looking at the big bills, then we will have to expand it to the outpatient care, the preventive care, and hopefully also the long-term care, so that we will not put too much pressure on our acute care institutions, the hospitals. So
on a topic of affordability, it's a serious concern for a lot of seniors. So how do you see this panning out?
I think in this generation, we'll probably have to sustain the MediSave top-up for the next 20, 30 years. But it will be almost like a one-off for this generation. I think subsequent generations who would be earning more and therefore would have enough medical savings, I think eventually we will have to tweak the system to make sure it's balanced. So we have to balance what is affordable and what we can sustain in the long term.
So the question is, how much will the government, do you think, need to subsidize?
Well, that's a kind of a guessing game because this is Chinese New Year when the Ang Pao was, or Hong Pao was announced. So everybody is curious to peep in to see how much. So, well, you can take a guess like for 500,000 people. And if our average spending is more than 1,000, the average premiums for MediShield Life, so you should expect it to be more than $500 million. But definitely, I think there will have to be more than that because you also have to enable this group to be able to pay for some of the outpatient expenditure and some of the co-payments and deductibles as well. So I think it's going to be quite substantial.
$500 million, that's
definitely more than that. Definitely more than that. And it has to be sustained over the next 20 years or so.
So some people have criticized the Pioneer Generation package as, quote, the ambulance waiting at the bottom of a cliff, because they're saying that health should come before healthcare. So how would you like to see restructuring of our healthcare system better reflect this in the future?
Well, yes and no. I think this is just a start. So we have to take care of the emergencies, the people falling on the cliff, but at the same time, we have to prevent them from falling on the cliff. So I think we have to spend a lot more on the substitutes to hospital care and say preventive care as people start aging, all those lifestyles, things which are not very popular to get people to exercise and to make sure they eat right. So I think public health will have to be emphasized, and also we have to look at alternative and substitutes to hospital care, which is long-term care. So all those community health services will have to be built up as Singapore society starts aging more and more.
So planning for infrastructure down the road.
Exactly.
Okay,
Yes.
thank you very much for coming
Thank
today.
you very
It's a pleasure
much.
speaking
Thank
to you.
you.
And that was Professor Phua on healthcare concerns, especially for seniors, ahead of budget, which will be announced this Friday. On that note,